I'm going to disclose that all the information I'm going to deliver today is from the American Cancer Society. Now there's different organizations that sponsor information. This is whom I've chose to divulge information to you. And I know it can be confusing because on the television you hear this one's recommendation and then you hear that one's recommendation and you go, my goodness gracious, what am I to understand and know and do? Today we're going to be dealing with the American Cancer Society's guidelines. I'm going to talk to you about facts regarding breast cancer. Did you know that breast cancer is the most common cancer among women? Is that true? I'm looking around. No. Skin cancer is actually the most common cancer. Okay? It is known, though, that with breast cancer, 1 in 8 women, look around the room, 1 in 8 of you will obtain breast cancer in your lifetime. Pretty sobering fact, if you ask me. Breast cancer is the second leading cause of death in American women. The leading cancer today is lung cancer. And there's approximately, going back to breast cancer, and if I misleaded you there, skin cancer is the most common, but the most common cancer that causes death, I should clarify that, is lung cancer, okay, in women. But I want you to know that approximately 39,000 women in the year 2013 are going to die of breast cancer. And we've come a long way. So that tells us we have a little bit further to go, doesn't it? Anybody here know what a risk factor is? She does.
Heredity.
Yeah, heredity is something that we will talk about that is a risk factor, but I'm going to go even more elementary. A risk factor, and I thank you for answering, is a factor that does not mean you'll end up with the disease, but that you have a higher incidence. And by what I mean by that is if you went out and you went on a motorcycle ride and you didn't put your helmet on, you have a higher risk if you should crash your bike of having a brain injury. If you should lay out in the sun for hours at a time and not put sunblock on, you have a higher risk of developing skin cancer. It doesn't mean that you will, but it is a risk factor. So know that having a risk factor doesn't necessarily mean that you will end up with that disease. Okay? There are some risk factors that we can't change, and you just said one. What did you say?
Heredity.
Right. Another one is gender. All of us here are females. That is a risk factor of developing breast cancer. But I want you to know, I said all of us here, and I should have said sitting in the audience. There is a man there taping, and there's a man there sitting. Men can develop breast cancer also. So that's important to understand. Age. We're living longer. Congratulations to us. But as we live longer, we have a higher incidence of developing breast cancer. So women, be aware of that. Own our age, but own our responsibility to take care of God's temple, which He's given us. Family. Here she goes. About 5 to 10% of breast cancers are thought to be hereditary, resulting from a gene mutation. And as I'm going to stop there and I'm going to say something. My name is Sherilyn May Ruth Anna Rehm. Wow. All those names, they were all given to me from my family, my heredity. So, your name is?
Kathleen.
Kathleen. So she has something that she takes with her from her family. Some of it's good, Some of it may not be good. We want to own the good, but we also want to be aware of where we are. Okay? Another risk factor that I want to talk about is personal history. If you have had breast cancer, you have a 3 to 4% fold increase of developing another breast cancer. Now, I'm not talking about a reoccurrence. I'm talking about a new breast cancer. So if I had breast cancer in this breast and it was removed, I still have a higher likelihood of developing breast cancer either in this breast or this breast. It's not a reoccurrence, it's a new breast cancer. So be cognizant, okay? Race. Do you think white women or Afro-American women or Asian women are at higher risk of developing breast cancer, or do you think no one? We're all equal. I'll tell you, white women have a slightly increased risk of developing breast cancer. I will tell you that Afro-American women are more susceptible of dying from the breast cancer. And Asian, Hispanic, and Afro-American women also fall in that realm. Now, dense breasts, and again, we're still talking about risk factors. Do you know what a dense breast is? How many here have had a mammogram? Ah, very good. I am so proud of you all. Yay! Kudos. How many here have been told they have a dense breast? Okay. Elsa is in the back. I told her I wouldn't isolate her, but I'm going to isolate her. Can you tell me what a dense breast is? Just, you know, it doesn't have to be an exact wording, but what you think a dense breast is.
It's more vasoglandular, less fat on it, and dense.
Yeah, exactly. It's kind of like looking through a window that maybe has a film on it. It's harder to see. So dense breasts are made up more of fibrous and glandular tissue as opposed to fatty tissue. So in reading a mammogram, it may be a little bit more difficult. So know that. And that is a risk factor. Benign breast conditions. Has anybody ever heard of mastitis when they were breastfeeding? Breastfeeding mastitis can cause an infection or an inflammation. That's actually a risk factor, as well as having fibrocystic breast disease. And we hear that term a fair amount. People that drink a lot of caffeine, people that like chocolate, it can bring them at an increased risk for fibrocystic breast disease. It's a benign condition, but it can increase your risk of breast cancer. Menstruation. Who would have thought of that as being a risk factor? Did you know that if you start menstruating early, before the age of 12, if you go through menopause after the age of 55, you have a higher risk of developing breast cancer? The reason behind that, if we think about it, is because during that time frame, we have more exposure to hormones such as estrogen and progesterone. So think about that when you're saying, I don't need a mammogram. Think about that. This is something that I bet no one here would think about. And honestly, if I wasn't in medicine, I wouldn't think about it. But did you know that young women who've received radiation therapy on their chest for medical conditions such as Hodgkin's and non-Hodgkin's have a higher risk of developing breast cancer? The reason behind that is they had to have that radiation to save them from that disease process, but they got that radiation during the time that their breasts were developing. So those women really need to be looked at and really followed through. So if you hear someone say that, they need to get those mammograms a little bit sooner. Does anybody know what DES is? How many here were having children in the 1940s, 1960s? My mother-in-law says she was the only one. Well, DES is a medication that they gave, or a drug, to some women to help them lessen the possibility of a miscarriage. However, through medical science, as we always do, we came to find out that those women that received DES had a higher likelihood of developing breast cancer later in their life. Now, I want you to take away a point here. It doesn't necessarily just mean the woman that took the medication. If, Donna, you were in vitro and your mom took that medication, you have a slightly increased risk. So talk to your parents. Know whether or not this was something that happened. Sometimes parents don't like to talk about things, but sometimes we need that information. Okay? Lifestyle. Lifestyle can be a risk factor. And we all are going to go, oh boy, here she goes. This is true. Some of the things that we're going to talk about, I'm just going to touch them. I'm just going to touch them. Alcohol, smoking, inactivity. They are all lifestyle risk factors that can affect your health, including your breast health. Brenda already said we have a beautiful wellness center here. We have programs to help you stop smoking. We have programs to help you exercise. Look into it. Go for it. I empower you all. Other risk factors or lifestyle risk factors are women who have had children later in life. That is a risk factor, something to let your doctor know. Women who are using birth control, it does slightly increase the risk of developing breast cancer. And I'm not saying don't use it, okay? I just want you to be aware of. And it is found study-wise through the American Cancer Society that once you stop birth control, in about 10 years, you go back to a normalization state. Depo-Provera, I don't know if any of you have heard of that. It's a shot that women get today. It is also a contraceptive measure. If they stop that, after approximately 5 years, they go back to a steady state. But I just want you to be aware of those things because we may have children, grandchildren that are thinking about, and I encourage you to lead them to where they need to be. It's a decision. They may talk with their husband, they may talk with their pastor, they may talk with their medical doctor. Okay? Now, I'm going to get blasted for this one, and I'm ready for it. Hormone replacement therapy after menopause. Wow, I get this a lot in my practice. I'm passionate about it. I didn't tell you that I came up through the ranks as a candy striper. Does anybody know what a candy striper is? Yeah, some. Those are those little girls that walked around with those little pink and white uniforms that everybody thought was peppermint sticks. Nah. I was a nurse's aide. I was a surgical technician. I was a registered nurse. I was a nurse practitioner. I was a surgical nurse practitioner. I was also a lieutenant commander in the Navy for 23 years. The bottom line is I'm older than dirt. I've been around for when they talked about, estrogen, hormone replacement therapy, taboo. I remember the surgeon saying, taboo, too many breast cancers, no, no, no. Then all of a sudden we did another study and we said, what? Hormone replacement therapy is great. It's great. It's cardioprotective. Helps with your bones. Increases your memory. Wow. Everybody wanted it. Then we came back to the drawing board and we said, hold on. It may be helpful here, osteoporosis. It may be helpful with memory. Cardiovascular, not so much. Breast cancers, not so much. And that's confusing, and I apologize. I apologize that medicine fluctuates and waxes and wanes, but remember, medicine is the practice of medicine. It's not an exact science, as much as we would like it to be. Okay? Hormone replacement therapy, estrogen and progesterone increases the likelihood of getting breast cancer. It also increases the likelihood of dying from that breast cancer after 2 years of treatment. Now, I don't know how you feel, but I think, wow, that makes me a little nervous. When it's found, it can be found in a more advanced stage also. So the key message that I tell my patients is the smallest dose for the shortest period of time. And I know all of you and some of us have vasomotor activity, hot flashes, that are more pronounced than others because we're all different. My mother-in-law never had them. This young lady has them all the time. You may have them when you're sleeping. But we need to take and think about what we want to do with our bodies. Ultimately, it's your body. You make that decision. I can give you the information. You make the final decision. We may agree to disagree. As long as you understand, I will help you, but I'm going to let you know, just like I did. Okay? Now we're going to talk very briefly, and I thank you for, you're so attentive. I love it. I love it. We're going to talk about the recommendations of what the American Cancer Society says. Do we need a mammogram?
Yes.
Really? Why? Ow, they hurt. I don't want it. Oh, it's a moneymaker. Why do we need them?
It just cancer early.
It does. It's the gold standard. Is it 100%? Okay. Does anybody here know of anything that's 100% except for our good Lord above? Okay. Good point. And yes, we do need mammograms. The American Cancer Society says after the age of 40, women need breast mammograms every year. Last year you heard on the television whether or not they were going to change it to 2 years, and maybe some organizations have. I personally feel that every year after 40, because I told you already, the longer we live, the higher incidence we have of developing breast cancer. So every year you need to have that done. But my framework says if a woman is living long enough and their health is not very good, do they need to have that mammogram? And this becomes a personal choice. I am a woman who is 92 years of age. I have congestive heart failure. I can't walk from here to here without being out of breath. And I have dementia. Should I have a mammogram and go through surgery? Very good. So we need to think about the whole picture when we're giving patient care. And that's what I try to do. So you had excellent answers there, and I'm so proud of all of you for them. It is said that women in their 20s and 30s should have clinical breast exams. Does anybody know what a clinical breast exam is? Yeah. That's what I do. Yeah, it's what your doctor does when you go in and you have your exam. It's not what you're doing at home. It is felt that we should have clinical breast exams usually every 3 years when you're in your 20s and 30s, unless you're having your well woman exam, and that's usually incorporated right in with that, okay? Now, women that are in their 40s, when they get their annual breast, or mammogram rather, I'm sorry, they should also get a clinical breast exam. Because as I said, mammograms are not 100%, so sometimes the actual palpitation, we may pick something up, whether it's a cyst. Nonetheless, you need to have that exam. The providers are not asking to make money when they ask you to come in. They're asking to be good stewards of your health. Okay? There are digital mammograms, and there's also the regular standard mammograms, and you're going to hear these terms come up. Digital is where we're going, you know, with a lot of computerized studies of that nature. Standard mammograms are from my age, you know, the radiographic film, like when you get films developed. Now, it's going to depend on the institution, what is cost effective for the patient, for the institution, for the area. They're still both very good, very accurate. So I just wanted you to be aware of those two different terms when you hear them, okay? MRIs. We all think of MRIs in the brain. We think of, that's what I think about, MRIs when we're looking for hips, backs, things like that. But we do MRIs of the breast. And we do MRIs of the breast because of the fact that we're looking at the more moderate to high risk patients. There are certain patients that carry what we call gene mutations. BRCA1 and BRCA2 are the most common. I'm sure you've heard them on commercials, etc. It doesn't mean that everybody should run to the doctor and say, I want a BRCA1 and BRCA2 gene testing. They're very expensive. They're used specifically and have a very good place for women who are at high risk. If your mother had breast cancer, your sister, your daughter, those are first generation family members, then it may be advantageous for you to have those studies. And we do MRIs when there's a risk factor such as that. Let's say you had a BRCA. Would we do an MRI? Yes. Would we do a mammogram? Yes. They're done together. They're not done independently. An MRI is more sensitive, but it's not necessarily more specific, so they're done in conjunction. We're also going to do them for that young girl who had radiation to her chest, because she's high risk. And we're also going to do them if you've had a personal history of breast cancer. Okay? That's where the MRI comes in. So don't think that your doctor or your provider isn't caring about you because they're doing the mammo and not the MRI. But if you say, oh, you know, Dr. Blackstone, Sherilyn Rehm, I had breast cancer 10 years ago. Do I need to have this MRI? Bring that to them, because you might have been seen up in Virginia. Florida is a kind of, I call a melting pot, because we get a lot of people from a lot of different areas, and information doesn't always filter down. So please, inform us. Don't think that you're going to, at least with me, you're not going to upset me. Tell me. I want to be informed, and I want to be able to take care of you the best possible way. Okay? So with that, I hope that I've given you information that you can take with you, and I hope that information you're going to turn around and make it ammunition. Okay? I want you to be proactive. I want you to look in the mirror and love yourselves. And I want you to know that there are people out there that can give you information, whether it be your nurse practitioner, your doctor. There's organizations that are going to give you things. There's sister strolls. There's so many, many things today. And the bottom line that I want to say is we have control. Okay? We burned our bras in the 60s. We still have our breasts. Take care of them and take care of you. And with that, I want to thank you. I want to thank you for the time. I want you to enjoy the refreshments. Tickets will be given for your door prizes, and there's 5 of them, so y'all have a pretty good chance of winning. And I want to thank you. Thank you for being here to look at the Pink Army. I want to thank you for picking up this information. And most importantly, I want to thank you for spending the afternoon with me. May God bless you all.